Well, group placement should be the very last resort. Like every other option should be exhausted until that is just like the last resort or no resort.
This trauma, it doesn't leave. And as I said earlier, that every moment that we spend with these young people, we're either destroying them or we're helping build them. So the question is that can residential work? No, I don't think so.
I've seen more of a shift to be more family-driven youth guided. It just makes so much sense and it's more affordable. We train all over the country, our agency does, and folks are just wondering how you make it work, how you pay for it, a lot of the same questions that you're asking. So there is like a hunger and a thirst to do this work in that way. The resistance, I think the public agency may move slower to change because of the bureaucracy. So it's like turning a cruise ship around, whereas the agency might have a lot more flexibility and be more nimble.
I think we should start with the parents, right? Like, we never are creating space for our parents to have a voice. After all, it is their children. I think we should ask them, what do they think that they need as a family? And helping our parents be intentional with being truthful and behind what they feel they need as a support. And it's okay, we all need support.
Pour that money into communities and different resources who have this as a barrier, opposed to constantly funding places that incarcerates youth. Because that's what they do, they incarcerate youth and then they call it support.
As we think about how we evolve and move forward, there has to be a long-term answer about how to intentionally allocate dollars towards prevention. Would I prefer as a provider that each organization start with what their shared values are? Absolutely. I think it has to be about what you believe and not about the money. That is a provider's responsibility to clarify what they believe. I believe the government's responsibility is to commit to sustainably fund those efforts.
There's also resistance around safety. Now, if I have a county social worker that's responsible for this youth going home and being safe, their biggest fear is something bad's gonna happen and they're gonna be in the paper, their agency's gonna be in the paper, and it's just gonna be bad for everybody around. But when you build a relationship with them and they see that we can put the supports in place to maintain safety, we're working on that one plan, one team in that child and family team meeting. We're sharing the risk and we're putting in the supports that give us confidence that we can reunite this family.
We induce trauma. So, it's healthier when the community or nonprofits in the community, such as Vester Community of Hope, intervene, because they don't just do the child or even the therapeutic support, but they do other things.
We made a bold decision to end all of our residential services. And we did not take that decision lightly. We had been doing those kinds of services for 130 years and had a very good reputation serving over 50 teenage girls on our campus that had experienced abuse and neglect. It doesn't mean that there is never a place for a higher level of service, a higher level of care. We just decided as an organization to make a strategic shift to more proactive and preventative services. And so our journey to transitioning away from residential care was not an overnight process. That took multiple years to do intentionally and carefully, because we wanted to make sure that as we moved towards prevention, we still were taking good care of the children that were in our residential program and allowed them to transition away and the organization would close residential programs through attrition. That would allow us also to shift staff. As staff left, we could shift staff to other parts of the organization.
Disproportionately, I believe in our residential program, It's probably about 40% Black youth in there, but yet we're 12% of the population. So it's definitely a misrepresentation. Now, in order to do that, the peer supports play the key role.
I know housing is a big thing. Food security, that's another one. Equal access to education. Healthcare, that's a big one. Those are vital things in regards to seeing a family flourish, or feel supported.
Does a young person who's acting a little unruly in school and is running with the wrong people and being aggressive, do they need to just be sent away? I think you're putting more gasoline to the fire. So now what you're doing is you're building a sense of, now your parents become your enemies. You sent me to this place. You took me away from my community. Maybe all I needed was some support from somebody who's been here before. Let's try that first.